The nurse is caring for a client who is receiving warfarin and reports multiple dark, tarry bowel movements. The nurse should expect that the client will be prescribed 1. Vitamin K, 2. Protamine sulfate, 3. Acetylcysteine, 4. Activated charcoal. Answer 1. Warfarin is a vitamin K antagonist and anticoagulant that prevents the production of vitamin K-dependent clotting factors. Consistent levels of vitamin K and warfarin are necessary to achieve a therapeutic INR, which measures the amount of time it takes for blood to clot. The therapeutic INR range depends on the indication for anticoagulation, e.g. atrial fibrillation, prosthetic valve prophylaxis, and is individualized for each client. A supertherapeutic INR can cause bleeding and may require the administration of vitamin K, the antidote to warfarin. Vitamin K stops warfarin-related bleeding by increasing the production of clotting factors. 14. The nurse is teaching a client who has a new prescription for clomipramine. Which of the following statements by the client would require follow-up? 1. I understand that I can take St. John wort to improve my mood. 2. I will consider using lubricating eye drops if I experience dry eyes. 3. I will continue taking this medication even if my symptoms improve. 4. I understand that this medication may cause worsening depression. Answer 1. Tricyclic antidepressants TCAS, e.g. clomipramine, amitriptyline are used to treat neuropathic pain, insomnia, and major depressive disorder. Most TCAs work by blocking the reuptake of norepinephrine, NE, and serotonin, but some block only NE. 15. The nurse is talking with a client who is taking amitriptyline. Which of the following statements by the client would require follow-up? 1. I will take an additional dose of amitriptyline if I miss my dose from the day before. 2. I should increase my intake of water and fiber while taking this medication. 3. This medication may be taken at bedtime to avoid daytime drowsiness. 4. My vision might become blurry when I start taking amitriptyline. Answer 1. Tricyclic antidepressants TCAs, e.g. amitriptyline, clomipramine are used to treat neuropathic pain, insomnia, and major depressive disorder. Most TCAs work by blocking the reuptake of norepinephrine, NE, and serotonin, but some block only NE. Adverse effects of TCAs include cardiovascular effects, e.g. tachycardia, orthostatic hypotension, QT prolongation, central nervous system effects, e.g. sedation, seizures, and anticholinergic effects. 16. The nurse is observing a staff member caring for a client who has a tracheostomy and is receiving mechanical ventilation. The nurse should intervene if the staff member is observed. 1. Deflating the tracheostomy cuff. 2. Administering an anxiolytic to the client. 3. Providing a communication board to the client. 4. Ensuring that two fingers fit under the tracheostomy ties. Answer 1. A tracheostomy tube is an artificial airway inserted into the trachea through the neck and is used in clients who require prolonged mechanical ventilation. Mechanical ventilation provides respiratory support by using positive pressure to deliver air into the lungs through an artificial airway. 17. The nurse is caring for a client who is receiving amoxicillin. It would require immediate follow-up if the client reports 1. Decreased appetite, 2. Blistering of the skin, 3. Abdominal cramping, 4. Curd-like vaginal discharge. Answer 2. Amoxicillin is a penicillin antibiotic used to treat bacterial infections, e.g. streptococcal infections, pneumonia, urinary tract infections. Manifestations of SJS include a burn-like rash, flu-like symptoms, e.g. fever, fatigue, blistered lesions, often involving the mucous membranes, keratoconjunctivis, inflammation of the cornea and conjunctiva, epidermal shedding, often on the face, trunk, and palms. 18. The nurse is teaching a client with atrial fibrillation who has a new prescription for warfarin. Which of the following statements by the client would indicate a correct understanding of the teaching? Select all that apply. 1. I should avoid becoming pregnant. 2. I can take aspirin for minor aches and pains. 3. I will need to have routine monitoring of my INR. 4. I will eliminate green, leafy vegetables from my diet. 5. I can expect to experience occasional blood in my urine. Answer 1. 3. Warfarin is a vitamin K antagonist and anticoagulant that is commonly prescribed for clients who have an increased risk for thrombus clot formation, e.g., atrial fibrillation. Warfarin blocks the synthesis of vitamin K-dependent clotting factors, preventing clot formation and reducing the risk for thromboembolic events. 19. The nurse is talking with a client whose spouse died 18 months ago. Which of the following statements by the spouse would be a priority to follow up? 1. I was angry for a few months after my spouse's death. I felt like my spouse abandoned me. 2. My family planned to visit me on my spouse's birthday last month, but I stayed in bed all day instead. 3. I enjoyed gardening and volunteering before my spouse's death, but I no longer have interest in hobbies. Answer 3. Grief is a natural adaptive response to the death of a loved one or to another loss, e.g., divorce, life-altering illness. Grief affects emotional and cognitive function, e.g., difficulty concentrating, and causes physical, e.g., appetite changes, sleep disturbances, and behavioral changes, e.g., loss of interest in hobbies, social withdrawal. 20. The nurse has attended a staff education program about anticoagulant administration. Which of the following statements by the nurse would indicate a correct understanding of the program? 1. Vitamin K should be administered to a client if an apixaban overdose occurs. 2. Clients who are receiving rivaroxaban should obtain routine monitoring of their INR. 3. Heparin may be indicated for a client who has a new prescription for warfarin. Answer 3. Warfarin is an anticoagulant that takes 5 to 7 days to induce a therapeutic INR. Until a therapeutic INR is achieved, heparin and warfarin are administered concurrently to ensure adequate anticoagulation. 21. The nurse has attended a staff education program about seizure precautions. Which of the following statements by the nurse would indicate a correct understanding of the program? 1. I will offer the client juice to drink immediately after the seizure has ended. 2. I should leave the client's room to retrieve necessary medications if the client begins to have a seizure. 3. I should place an oropharyngeal airway in the client's mouth at the onset of the seizure. 4. I will lower the client to the ground if the client is in a standing or seated position when the seizure begins. Answer 4. Seizures are episodes of irregular electrical activity in the brain. Manifestations of seizures vary but include a decreased level of consciousness, changes in muscle tone, jerking of extremities, and incontinence. Clients experiencing seizures are at risk for injury and airway compromise. Seizure precautions are implemented for all clients at risk for seizure activity. 22. The nurse is observing a staff member talking with the spouse of a client who has just died. Which of the following statements by the staff member would require the nurse to intervene? 1. I would like to sit with you if that is all right. 2. Are you anxious about the loss of your spouse? 3. There is no need to rush to make decisions at this moment. 4. Do you have any specific rituals or family customs I can help facilitate? Answer 2. Grief is a natural adaptive response to the death of a loved one or to another loss. During the time of an acute loss, the nurse should engage with family members using therapeutic communication techniques such as active listening, open posture, eye contact, open-ended questions. 23. The nurse is talking with the parent of a pediatric client with asthma who uses an albuterol metered dose inhaler MDI. The parent reports that the client has difficulty using the inhaler due to a lack of coordination. Which of the following actions would be essential for the nurse to take? 1. Teach the parent about using a spacer with the albuterol MDI. 2. Instruct the parent to monitor the client's peak expiratory flow rate every day. 3. Recommend that the parent administer an inhaled corticosteroid prior to the albuterol MDI. 4. Suggest that the parent administer an additional inhalation if the first inhalation is unsuccessful. Answer 1. Metered dose inhalers MDIs deliver aerosolized medication by inhalation. For clients who have difficulty using an MDI, a spacer can be added to trap the medication in a confined space, giving the client more time to inhale the medication and increasing the amount delivered to the lungs. 24. The nurse is caring for a client receiving atorvastatin. The nurse should recognize that the client is at risk for developing 1. Chronic kidney disease, 2. Rhabdomyolysis, 3. Hypoglycemia, 4. Cholelithiasis. Answer 2. HMGCA reductase inhibitors statins e.g. atorvastatin are commonly used to lower cholesterol levels. Rhabdomyolysis is a serious adverse effect of statins that occurs when muscle tissue is damaged and myoglobin is released into the blood due to the rapid breakdown of muscle cells. 25. The nurse is caring for a client with newly diagnosed hypertriglyceridemia. The nurse should expect that the client will be prescribed 1. Metformin, 2. Clopidogrel, 3. Gemfibrozil, 4. Propylthurosol. The correct answer is 3. Gemfibrozil. Fibrates e.g. gemfibrozil, fenofibrate are used to reduce triglyceride levels and increase HDL levels in clients with hypertriglyceridemia. Adverse effects e.g. hepatotoxicity. Rhabdomyolysis of fibrates are similar to those of HMGCA reductase inhibitors statins and occur more often in clients receiving both medications.